Quickly in China, quickly spread around the world, and maybe even to North Carolina. Good evening, and thanks for joining us. I'm Marius Payton.
I'm Angela Taylor. We're talking about the dangerous coronavirus. Tonight, China is expanding its lockdown against the deadly virus to 36 million people. The number of confirmed cases around the world has climbed sharply to more than 1,200, and at least 41 deaths, all of them in China. Earlier today, France confirmed 3 cases of the virus, and tonight in the USA, a second confirmed case. This one, a Chicago woman who just returned from China.
And now a possible case right here in North Carolina. CBS 17's Mackenzie Stasko live tonight at RDU, where the woman flew in just yesterday. Mackenzie.
That's right. That woman was traveling from Wuhan, China, had a layover at JFK Airport in New York, and then landed here at Raleigh-Durham Airport sometime yesterday. Airport officials tell us that the woman recognized the symptoms, that it could be the coronavirus. Then it called the CDC and is now currently in isolation at Duke University Hospital. The doctors there tell us this is a situation they've spent years preparing for.
The patient who's here is doing well and is under care with our infectious disease specialists and team.
With the patient in isolation, Duke University Hospital President Dr. Thomas Owens assures no other patients or employees are at risk.
Our teams worked with the Centers for Disease Control in Atlanta and our State Department of Health to ensure that our team is well trained in all aspects of how to appropriately assess a patient that may have this kind of infection.
The hospital isn't treating or monitoring any other passengers who are on board that same plane.
And the risk to patients who may have been near the patient we're currently treating, we believe would be quite low.
We found one traveler who flew in from JFK Airport in New York.
My secretary asked if I wanted a mask for the plane ride, so it sounds like it's pretty serious.
But the majority of travelers tell me they're not concerned.
I travel for work, so there's not really much I can do. No need to be too worried. I think one isolated case isn't enough to be panicked.
Now again, state health officials say you are at low risk for the coronavirus if you have not traveled to China recently. Now, despite that person coming through RDU with symptoms of the coronavirus, airport officials say there are going to be no other travelers being screened for that virus. However, here at the airport tonight, we have seen about a dozen people or so taking precautions, wearing those masks that you've seen. Live here at Raleigh-Durham Airport, Mackenzie Stasko, CBS 17 News.
And this afternoon, an email went out from Duke University Hospital to all of its employees.
The email explains the testing is being done by an external facility, and the hospital wants to reinforce the risk to the staff and the community is low. While the hospital waits for the test results, the patient is being cared for in a contained and isolated unit by volunteers from Duke's infectious disease team. They're all specially trained in the treatment of patients with novel viruses. The hospital also has a comprehensive response plan that follows the CDC guidelines and recommendations. The email also reminded everyone to practice good hand hygiene and use appropriate personal protective equipment to avoid the spread of illness at the hospital. And again, anyone who has returned from China within the last 14 days and is sick with fever and cough or difficulty breathing should seek appropriate medical care right away and call ahead to the doctor's office to inform them of recent travel and symptoms.
Now, the State Department of Health and Human Services say the risk of anyone getting the coronavirus in North Carolina is low. So far, the number of deaths from coronavirus, 41. And to compare that, so far this flu season, 41 people just in North Carolina have died from the flu.